lesson, I just want to run through a few key things to think about when you're selecting a dressing for a wound. So, a lot of times you'll have very specific wound care orders, but sometimes we actually need to use our nursing judgment on how to choose an appropriate dressing based on the wound. So, the first thing we need to look at is that there's multiple different types of wound healing and wound closures. So, one of the things that we need to know about our wound is how are we managing the healing of the wound? So, the first type is primary intention. So, primary intention is a clean wound with no tissue loss. And usually, what you'll find is that the edges are approximated. And so the great example of this is surgical incisions. They make an incision and they open it up and then they simply bring it back together with sutures or staples or maybe glue. Now, the second kind is secondary intention. This is where there's been some sort of loss of tissue or it's a jagged wound of some sort. So a great example of this is trauma to the tissue. So the goal with secondary intention is actually to let the wound granulate before we close it. And actually, sometimes we'll just let it completely granulate on its own instead of forcing closure like we do with a primary intention. Sometimes you might have just a deep wound. We let it granulate up and grow in itself. That's secondary intention. Now, tertiary intention is where we actually intend to leave the wound open. Now, we either do this because we're going to provide a graft to close it, or we're just going to wait and we close it later. So this actually happens a lot with exploratory laparotomies or XLAPs, where we literally open up a patient's abdomen and then just leave it open to help allow the swelling or the drainage to decrease before we close the abdomen altogether. So it could also be just a very large pressure ulcer or another wound that requires debridement. So it's a big part of tertiary. We leave it open because we're going to go back in here and take out the dead tissue pretty frequently while we wait for it to close up. So that's tertiary, is we actually intentionally leave the wound open so that we can continue to debride. So let's just quickly review the purpose of using dressings for our wounds. It could be to slow or stop some sort of bleeding. There's actually a specific dressing type that can help with this, which we'll talk about in just a second. We also want to make sure that we prevent infection in our wounds by providing a barrier between the wound and the outside world. Dressings can also help to absorb drainage, provide debridement for wounds with eschar or slough that needs to be removed. And then lastly, dressings can actually help to reduce psychological stress because the patient doesn't actually have to look at the wound because the wound is covered. So there's a few things you're going to want to assess on your wound before you determine what kind of dressing you need. First, is there any exudate? An exudate is just a fancy word for drainage. And how much is there? What kind is it? What does our wound look like? Is there eschar or slough? Is it already granulating? All of those things are going to help us pick a dressing. We also need to know if we're going to need to debride it, if we're going to need to place pressure on it. And of course, we also want to determine how high the risk for infection is, because in this case, we may end up needing an antimicrobial dressing option. Before I talk about specific dressing types, I just want to give you a couple of different considerations when it comes to choosing dressings. One is regarding moisture. So the big thing to know here is we never want a wound to be too moist or too dry. If you have an extremely moist wound bed, it is going to be a breeding ground for bacteria, and you are at high risk for infection. If you have a wound that is too dry, you actually have trouble fully granulating and healing. So either way, it's not good. So if your wound bed is too moist, you need to dry it out. So when you remove that dressing, it's going to be wet because we're pulling the moisture out of the wound. So good examples are dry gauze, foams, and alginates, which we'll talk about in just a second. If your wound bed is too dry, our goal is to keep it moist and keep the moisture in. So we can use something like a wet to dry dressing or a hydrocolloid or a hydrogel. Just remember, not too wet and not too dry. And now I remember I talked about specific dressings we can use for bleeding. If you have a wound with mild to moderate bleeding, you can use something called Surgicel. Looks like a little mesh like this. Sometimes it comes in sheets. Sometimes it comes in long, thin strips that you can use to pack a wound. You just apply it directly to the wound bed, and it actually causes the wound to clot, and it causes hemostasis. Now, of course, if you've got a severe bleed, you are not going to use this. You need to use some other options like a pressure dressing or sutures. Now, another thing to remember is that we can always use gauze wraps around other dressings or other wound care techniques. And we especially use gauze wraps when we need to do some sort of pressure dressing or to hold another dressing in place. We're also going to use gauze wraps for circumferential wounds that go all the way around, like an extremity or a finger, or for large, awkward wounds that just can't necessarily tape a dressing to. Now, I just want to quickly talk about the most common types of dressings that you're going to see in a clinical setting. Now, I didn't talk about standard dry gauze here because, well, it's gauze. Hydrogels. Hydrogels are 95% water. Think hydro, water. So the goal of a hydrogel is to actually increase the natural moisture in the wound bed. And that allows for what's called autolytic debridement, which is basically the body's own hormones and enzymes coming in to debride any dead tissue. So these are fabulous for wounds containing eschar. So hydro, water, and think debridement for hydrogels. Now, hydrocolloids, they can either come in a sheet or actually a gel that you squeeze into the wound. And they have a semi-permeable outside membrane and a hydrophilic inside membrane. Now, hydrophilic means that it attracts water. It's very absorptive. Now, hydrocolloids are great because they can actually stay on for multiple days at a time. These are really fantastic for a wound that needs moisture kept into it. So things like abrasions or partial thickness wounds. Now, alginates have something in them called calcium alginate. And calcium alginate actually reacts with the drainage and forms a gel. So the benefit here is it draws moisture away from the wound bed to prevent infection, but also prevents it from drying too much because that moisture stays within the dressing. So alginates are best for wounds with heavy exudate. Now, hydrofibers are really similar in benefits and properties to alginates. So they're great for wounds with heavy exudate. They create a gel using these hydrofibers. But the benefit of a hydrofiber versus an alginate is that there's less risk of maceration to the skin around the wound. So what happens here is you have this wound and you put this dressing over it, and then you absorb all this moisture in here. Well, that moisture can go out here and touch this healthy skin and cause maceration. And really, with hydrofibers, there's just less risk of that than there is with alginates. So foam dressings, as you can imagine, if you have a sheet of foam, are highly absorptive. So they absorb a ton of moisture into the foam itself. So the benefit of a foam dressing is that you get that moisture retention while also providing cushion. So foam dressings are fantastic for wounds over bony prominences like pressure ulcers. The only problem with foam dressings is they could potentially be too drying, so they're not recommended for heavy exudate wounds. Now, PMDs also stands for polymeric membrane dressings, have a semi-permeable external membrane and a hydrophilic polyurethane internal membrane. Hydrophilic meaning it absorbs moisture, maintains moisture. The cool thing about PMDs is they actually come in multiple thicknesses. So if you have more exudate, just get a thicker one. Benefits of PMDs, they enhance debridement, improve healing, and prevent infection. And as you'll see on the next slide, PMDs can actually be used for almost any type of wound. They're kind of a jack of all trades. Now, simple films, a great example of a simple film is something like a Tegaderm that you would cover an IV with. They are a thin, elastic, transparent dressing that simply provide a barrier. They are not absorptive. They don't have any other benefits. They simply provide a barrier between that wound and the outside world. So a great example would be like for a skin tear over an IV, things like that. And lastly, we may find that we need an antimicrobial if you've got an infection or high risk for infection. Two common examples are silver-based dressings and iodide-based dressings. They can come in a full dressing or in little strips that you can use for packing inside of a wound. One thing you really need to know here is that silver dressings require moist environments, so you wouldn't use them on a dry wound with a dry dressing. So really quickly, just to summarize what types of wounds require what types of dressings, let's go through 7 of the most common types of wound characteristics. For superficial wounds, we like simple films and PMDs. Remember, our jack of all trades. For wounds with eschar, which is like thick dead tissue, kind of like a 3rd-degree burn, we're going to look at hydrogels, hydrocolloids, and ta-da, PMDs. For wounds with lots of drainage, we're going to look at alginates, hydrofibers, foams, and PMDs. Just remember with foams, sometimes it may not be appropriate, so make sure that you're evaluating that. For wounds that are already starting to granulate, which means they're already starting to heal and present new tissue, we focus on hydrocolloids, hydrogels, and PMDs. Now, for wounds with a lot of slough is dead tissue that's falling off that needs to be debrided. We're going to use hydrogels and hydrocolloids, and we'll also often use simple wet to dry dressings. As that wet gauze dries, it will bring the slough off with it when you pull it out of the wound. For super deep wounds, we'll look at alginates, hydrofibers, hydrocolloids, and PMDs. Now, most of the time with a very deep wound, we are somehow packing this wound and then covering it with one of these sheet dressings. So you might see a wet to dry with a hydrocolloid over it, or a gauze packing with a hydrofiber over it. And lastly, for infected wounds, again, we want to use one of those antimicrobial dressings like silver or iodide impregnated dressings. So I know that's a lot of information, so let me just boil it down to a few key points. Remember, when selecting a dressing, consider the wound characteristics. What's going on with the wound itself? Is there drainage? Is there slough? Then think about the goals. What are we trying to accomplish with this wound? Are we leaving it open on purpose? Does it need to be debrided? Are we dealing with an infection? As you go through this process, make sure that you're working closely with your wound care nurse. They are specially trained just for this. Now, it's especially important to collaborate with them if you can tell that the wound is changing or it's healing and it needs a different type of dressing. Always verify your wound care orders. Again, sometimes they don't have specific directions, so you're going to need to use your nursing judgment and, again, use your resources. And finally, always make sure that you're looking for complications like maceration to the skin around the wound, reactions to the dressing itself, or, of course, possible infections in the wound. All right, guys, make sure you check out all the resources attached to this lesson, including the video guide, which will have these slides that you can download, as well as the rest of our wound care skills videos. Now go out and be your best selves today. And as always, happy nursing.